everyone, I'm Dia Pandey of stEMBARK, an organization made for and by teen girls who share the mission of ending the demographic imbalances in STEM fields by facilitating important discussions, sharing the stories of professional women and underrepresented minorities, and making opportunities to get involved more accessible to you guys. Today is very special because we're welcoming Dr. Jeanna Marraffa, a clinical toxicologist and associate professor in the Department of Emergency Medicine at SUNY Upstate Medical University. She also has a position in the American Academy of Clinical Toxicology. Before everything else, I would just like to thank you, Dr. Jeanna Marraffa, for taking the time out of your schedule to participate in the stEMBARK interview. We greatly appreciate it.
Oh, thanks for having me.
Yeah, thank you so much for being here. To start this interview, would you like to tell us a little bit about yourself? Where are you from? What's your educational background? And how and when did you become interested in pharmacy as a career path?
Sure. So I grew up in the Utica area, which is, for those of you, I'm not sure if a lot of people know where it is. It's about 60 miles east of Syracuse. And so I grew up there and currently live in Syracuse. So I've kind of lived pretty much on the corridor of I-90. But I grew up in the Utica area, and actually my parents owned a restaurant. So I began my early working days working in the restaurant, probably from age 11 on, and then knew I wanted to do something within science. Initially thought I wanted to do medicine, but had some questions about that and moved to starting to think about pharmacy probably, more in like my freshman and sophomore year of high school. After graduating high school, I went to Albany College of Pharmacy, which is in Albany, New York. And at the time, I was doing a pharmacy degree, was a 5-year Bachelor of Science degree. It's a little bit different now, but when I was doing this, it was a 5-year Bachelor of Science degree. And towards the end of my Bachelor's of Science training, the opportunity came to do an accelerated PharmD program or a doctorate in pharmacy program. And so I did that, rolled right into my 5th year of school through until I graduated with a PharmD degree. After I graduated with my degree, I really knew at that point that the career path of pharmacy that I was taking was more on the clinical pharmacy end as opposed to retail or other practices of pharmacy. And so in order to, at the time, the way that I really thought in order to really achieve that goal was to do further postdoctorate training. And so I did a 1-year pharmacy practice residency here in Syracuse, actually, at Upstate Medical University. And from that, actually, within my first month or so is when I was introduced to toxicology. I actually didn't really know toxicology at all. When I did anything in pharmacy school, I think I knew there was one antidote. That's basically what I knew. And so when I was, again, in my residency, toxicology and the practice of toxicology and the role of a clinical pharmacist in toxicology was really introduced to me. And so I was able, luckily, there was a new fellowship program that was being established here at Upstate of a 2-year postdoctoral clinical toxicology emergency medicine fellowship program. So I did that. And so I went right from my residency into my 2-year fellowship program. And then after that, it was about a year or so, I had to credential for the National Toxicology Board exam. There are certain criteria that you have to make to credential and then take the board exam. And so I became boarded in clinical toxicology in the fall of 2005, I think, 2005. And after fellowship, I actually was lucky enough that a position opened at Upstate, at the Upstate New York Poison Center. And so I've been there ever since. So when I came to Upstate, I thought I was going to be here a year. And now I'm rolling into my 20th year here at Upstate. So that's a little bit about my career path. And I'm not sure that toxicology was ever on my radar until I got to Syracuse. So.
Yeah. I believe like as young people, we're expected to know like what we want to do at a very young age. So it's very relieving to know that like you didn't know that you wanted to specialize in toxicology even in pharmacy school. So I really appreciate that input. I was also wondering if you could explain what your job as a toxicologist toxicologist entails on a day-to-day basis, and how clinical toxicology as a scientific discipline may differ from computational toxicology or forensic toxicology?
Sure. So, I guess I'll start with what clinical toxicology is, because I think it's a little bit easier to talk about the difference between clinical toxicology and then other, I guess, specialties within toxicology. So, clinical toxicology is really the study of toxins and xenobiotics and really their impact on the human body, right? And then subsequent treatment to manage sequelae of adverse events or poisoning or toxicity from a particular drug, substance, chemical, toxin. And so that can be a huge variety of things. So it can be, classically thinking about, side effects or overdoses of pharmaceutical products or medications. That's, a large part of what we do, but it's also other things as well, right? Toxicities of if someone ingests a mushroom, or snake bites or spider bites, scorpion stings. So it really can be the gamut of the effect of some toxin or xenobiotic on the body, and then trying to provide treatment recommendations for that. So, again, clinical toxicology is really focused on taking care of the patient. So recognizing if a patient is having toxicity, if they're at risk of toxicity, and then how might you be able to treat those patients. So that's really what clinical toxicology is. The Poison Center is part of clinical toxicology. So the Poison Center is, a 24/7 phone number that's staffed by very, very highly trained, qualified healthcare professionals that can be nurses, pharmacists, physicians that answer the phone when people call, and we're there 24 hours a day with answering questions and for a variety of different things. And, either being able to keep people at home because their child got into something and being able to say, oh, this is not a problem, you can keep this child at home, versus, intentional overdoses of people trying to hurt themselves and us providing recommendations to the treating providers and physicians that are calling us, as well as substance use disorder. So we get a lot of cases of people who have substance use disorder that overdose, whether it be intentionally or unintentionally. So that's largely what clinical toxicology is. There's other aspects of toxicology. There's forensic toxicology, there's analytical toxicology. There's often an overlap where, and especially within toxicologists, we like to have those relationships with people, but that's more, doing, say, a blood test or testing a specific specimen for a concentration of a drug or identification of what a toxic chemical is, either structurally or what that is in the body, or even after somebody dies, looking at what their concentrations are, and to be able to really determine and analyze how or if that toxin or toxins contributed to, say, the cause of death in somebody. So, there's the testing component, there's the interpretation of those results, and that's a lot of where kind of that analytical forensic toxicology comes in. And then the clinical toxicology really is more of the patient. And so marrying the analytical and forensic side with the clinical side is really important, because you kind of need to know, independent of just a serum concentration, say, if the person was demonstrating signs that are consistent with either the history or what drug that they took. So oftentimes we collaborate together, just because we're able to help each other in trying to piece that together.
That's really interesting to learn about sort of interpreting results, as well as learning what sort of tests to give. So that was very enlightening. Would you also talk about what the American Academy of Clinical Toxicology does, whether it's in research or community outreach?
Okay, yeah. So the American Academy of Clinical Toxicology, there's really three national, at least in the U.S., there's three national organizations that toxicologists are members of or have the ability to be members of. There's the American Association of Poison Control Centers, which obviously if you work at a poison center, you're a part of that. There's the American Academy of Clinical Toxicology, which you just asked, and I'll give you a comment on that. And then there's the American College of Medical Toxicology. And so the American Academy of Clinical Toxicology is a multidisciplinary group of scientists. So it can be anywhere from clinical toxicologists to medical toxicologists to PhD toxicologists to nurses to pharmacists, all with the intention of learning from each other, providing education, as well as the study of toxins and chemicals and things like that. So it's largely an organization where we all gather. We have an annual meeting every year. That's a lot of our continuing education events, and where you try to keep on top of your the cutting edge research and science and things like that. And it's also a group where we do outreach as well, largely to other healthcare professionals though. So it's largely more on the healthcare professional side, whereas the American Association of Poison Control Centers, they do a lot to educate the public and poison prevention and trying to keep people safe. So the AACT is something a lot of us are members of, and I've been a member of it for years, since 2001, I think, and became kind of started slowly into my role there. Someone asked me to help with being a co-editor of our newsletter several years ago. And that evolved into me getting on the board of trustees. And then that evolved into me becoming secretary, for which I'm now in my final term of secretary. So I've been secretary for the last 5 years, I think, maybe 4 and a half. And so my term of secretary will come up to an end in September of 2021.
May I ask, what are the roles as a secretary in this position?
Yeah, so it's interesting because obviously the classic things that you think about with being a secretary of any type of organization. So I'm responsible for all of the meeting minutes, the action items, and as well as keeping a tally of, if we have votes on things. So if we have any type of motions or policies that we're implementing, I'm the person that will send those out to everybody, and then we'll keep a tally of the vote. So if it gets approved or not, and then subsequently responding with some type of document. So that's the kind of the classic roles of a secretary. And so I certainly do all of that. I've also kind of, as part of my role, I somehow became involved in redeveloping the website. And so we had a whole new website probably about 3.5 years ago. And so that was part of my role. I think it was, kind of went hand in hand nicely with me being secretary, but isn't always the role that you do as secretary. And so in addition to those things, we have a daily, it's called Question of the Day. And so we send it out to all of our members via email. It's like a quick hit question of some toxicology related topic that's literature or evidence based. And so I'm also the person that is in charge with 2 other of my colleagues of getting those out 5 days a week. And so that's another part of my role that I guess is independent of me being secretary, but still something that I do.
Thank you. It's nice to hear that, as a pharmacist, you can do so many things with your different roles. Like, it's not just seeing patients or just giving medication. Yeah. It
is. And you make a good point, especially within my role of, I agree, there's a lot of opportunities. And one of the things that I think my role in AACT has really enlightened me to so many things, because even if you just look at our board, we're so multidisciplinary, and so there are on our board of trustees, there's physicians, there's pharmacists, and we all work together for, again, the better need of the academy, of the organization as well, and to be able to have evidence and science to be able to treat people better. So it's been one of the eye-opening things for me, is that, especially I think in toxicology, the ability for multidisciplinary teams and multidisciplinary services to work together is it's kind of standard, which in a lot of areas of medicine, that's not the case. But in toxicology, it very much is. And it's been a really enlightening process for me to kind of see that and go and see how it's evolved over the years.
So you've delved into what the training is like for a toxicologist by talking about pharmacy school, residency, and fellowship. Do you have any recommendations for what students can do concurrently along with these requirements, like, for example, graduate research opportunities?
That's a good question. I mean, I think that, for toxicology itself, a lot of times people don't really, it's great that you're doing this, because I think a lot of times people don't even really think about toxicology as even a subspecialty within pharmacy. It's just not something that common. But I think that if there's people if you're interested in toxicology, a couple of things that you can do, one, if you can find, depending on, are you looking more for clinical toxicology or forensic, depending on where you live, if there's a poison center in your area, if you could perhaps maybe do some volunteer work at the poison center. Poison centers often will take students and do education, and, there's projects and things, so to learn more about the poison center and toxicology. If you're interested more on the analytical side, certainly doing graduate research programs. So, large universities, they will often have a section of toxicology, or if not, more along the lines of advanced chemistry, or if, for example, if you work or if you have the access to perhaps a medical examiner's office or something where they do a lot of in-house testing, to be able to do some graduate research there is certainly an option. And then when you're in pharmacy school, if that is the career path, a lot of, depending obviously where you live, but there are the access and availability of clinical toxicology rotations. So as part of your pharmacy school training, you have to do several advanced practice clinical rotations. And so depending on what school you go to, you can set up, either if it's already set up or if it's not, we take probably on average of 30 to 40 pharmacy students per year at the Poison Center to do either a 5 or 6 week rotation with us. And so they see patients, they get exposure to the Poison Center. And so in a lot of poison centers and toxicology services have that available. So if it is something somebody's interested in, look to see if that rotation is available within your school. If not, oftentimes it's very easy to set up and then reach out to somebody. We always, if there's someone that wants to do a rotation with us and we've never been affiliated with their college of pharmacy before, there's some paperwork that you have to do, but it's really not that hard in the bigger picture. And so we, even this past year, we took a student from a brand new college of pharmacy that we've never taken a student from before, because they heard about our rotation and wanted to come here for 6 weeks. So there's that potential as well.
Thinking even more back to like high school or even middle school, because that's where a large part of our audience is right now. Were there any programs or resources that helped you pursue your career? And are there any particular steps you would encourage young girls who are interested in STEM to make?
Yeah. So, it's funny. I was thinking about this. It's been a long time since I was in high school, so I have to go back to my brain a little bit. But one of the things that I remember was, and I don't know if this program still exists out there in the world, but one of the programs that I was really lucky enough to have, it was called New Visions. And so it was, I think in ninth and 10th grade, you had to apply to be a member of this. And then you you were paired, you kind of told, what you thought your career goals were. And then they paired you in different rotation sites, if you will, to spend some time with various different professionals. And so I did that in 9th and 10th grade. I was lucky enough to do that. And that's actually where I was paired. I did several different experiences, but I did an experience at a local hospital in Utica with one of the clinical pharmacists there. And she and I spent, like a summer with her. And she was really integral into my decision-making of actually pursuing pharmacy school. So I wanted to go to medical school at the time, but I used to be quite honest, I used to faint at the sign of blood. And so, which is funny now of what I do, because I'm in the hospital all the time. And, so I was like, well, what else could I do that can you still hear me or no? Okay. What else could I do to be able to pursue that? And so that program alone was instrumental in me deciding to pursue pharmacy. So I don't know if there's programs like that anymore. This was like 1992. But that's an example of something that I know of that really changed my trajectory, I think.
I did a quick Google search and apparently it's still up. So we will make sure to feature that on our website. That sounds like such a cool program. And we think a lot of our members can take advantage of that. So thank you so much for talking about it.
Yeah, good. I'm glad that it still exists. My brother and I actually both did the program and both were just, really could not say enough things about it. It really changed. It really impacted our lives significantly.
Yeah. So we're really happy that we could share this with our viewers because that sounds amazing. Like, I wish I had taken advantage of something like that when I was a little younger, but yeah.
And I don't know how, there's probably other programs that are out there. I don't know that, but I often feel that a lot of times people don't even know that these programs exist and then therefore can't even take advantage of them. So, I think if I recall correctly, my guidance counselor was the one who brought it to me. So I think if I were in high school again, or even, late middle school, junior high, I think I would, if you have access to your guidance counselor, that might be a good first step to ask them what resources are available, and thinking about those, kind of alternatives or a little bit, maybe unconventional ways to get some real life experience.
Yeah, so thank you so much for sharing that with us. I'll make sure to put it on our website and possibly our Instagram.
Oh, good.
So were there any challenges or surprises that you faced throughout your job in education? If so, what have you garnered from them? And what could you say to others who might face similar challenges? And I know this question is pretty broad, but I just want to hear about the scope of your experience.
Yeah, that's, it's funny. I think there's always challenges, right? And in fact, I think anything that's really hard, if there's going to be a challenge and many challenges with it, if there are no challenges, it's probably not going to be that rewarding. But certainly I've had so many challenges, and they've begin with, the early stages of being a high school and college student and being able to figure out how you navigate that, especially for me, going from high school to college was a big transition for me. For me, high school was, I had to study, but it wasn't that hard for me. And I did okay. Whereas college was not the same. And so, I think that transition was really hard for me. In fact, it's kind of funny because when I went to college, and I'll never forget it, and it's probably been one of the most instrumental things in my life. I took a chemistry. It was the first test that I had as a freshman, and I got a 23 on it because I studied for 45 minutes the night before because I thought that's what you had to do, right? And because high school, I didn't have to study longer than that. And so, I had to call my mother and tell her I got a 23. And that I was going to fail out of pharmacy school. And, this was literally 2 weeks as a freshman. And so I had to navigate, like, that was a big challenge for me, because then I had to work 10 times harder. Right. And luckily it was just one misstep in my early career. But I think, I found, for me, a lot of academic challenges, I had to work 10 times harder than everybody else. And that was it. If someone had to study 5 hours to get a 90 on a test, I had to study 30 hours to get a 90 on a test. So, being able to know that about yourself, I think, and know how to navigate that, especially when you're in college with your friends, you have to make those tough decisions. And so that was, early on, that was a big challenge for me. And then, I think one of my mottos in life, which I don't know if I find it useful. I think you don't have to be the smartest person in the room, but if you're the hardest working person in the room, that is really, really important. And so all of my challenges in life is, if I work hard, then it's one of the, I guess, prices to pay for success. And so I think that's been, a big challenge. I think, residency and fellowship pose new challenges, just because they were so mentally and physically demanding. But I certainly think every day I have a challenge, right? And as I get older, I've learned how to navigate those a little bit more and to be able to advocate for myself, of which I still think that's something that especially females have a hard time with. And so that's a constant area of improvement for me.
When making that transition from high school to college, I know a lot of people get discouraged. So like hearing that story and like how you overcame that like one bad grade and like learned to work harder, that was very inspirational to me.
And not only to work harder, the other thing too is, everybody's going to have a bad test. Everybody's going to have a bad day. Everybody's going to make a mistake, and to be able to then not be that hard on yourself. So I think you have to, in addition to working really hard and setting high standards for yourself, which I think is so important, I think you also have to be a little gentle with yourself too. And that's always been something that I've not, I think we're all our worst critics, right? But I think, especially the older that I've gotten, one of the things that I always say, because I tend to be the hardest on myself, is, talk to myself as if I were to talk to my best friend, right? And I would never say some of those things that I think about myself to a friend. And so being able to do that a little bit. So yes, you're going to fail a test. You're going to make a mistake, but in recognizing that and taking ownership and responsibility, like I was like, well, I guess I needed to study more. Right. But at the same time, I didn't let that completely derail me and then not allow me to recover from that. So I think that's really important. And I don't think I ever really needed to know that or ever had to learn it until I was a freshman in college and really had to quickly recover from that and not beat myself up so bad, but also be able to say, okay, you need to actually study for more than 45 minutes for a college chemistry test, so.
I think I'm also going to adopt that method of talking to yourself as if you're talking to someone else, because I like, of course, like it's a high school level class, but like sometimes I feel like I don't know, I feel like I'm really tough on myself too. So learning to grow without being like super harsh is a very important skill that I hope that I'll be able to adopt better as I grow older. I did some research and I learned that there has been an upward trend in women who receive degrees at institutions that graduate the most students into toxicology. But despite this, there are fewer women than anticipated in the academic ranks of associate or full professor. Also, women are less likely to become core faculty or department chairs and take on administrative roles. Have you encountered any discrimination, gendered or otherwise, throughout your career in education? If so, what advice would you give to girls and minorities who may also experience this?
So that's a really interesting question. And I hope that by the time anyone listening to this, if they're in high school, by the time you're my age, you don't have to face gender or any other type of discrimination. But sadly, it's the world that we live in right now. I do think that things have gotten better over time, but we're still leaps and bounds far away from where we need to be. It's funny that you bring that up. I mean, yes, certainly there are more women that are graduating with higher level degrees and getting higher level jobs. That is 100% true. But your statement about women not having those high ranking jobs in academics or even in other healthcare avenues, how many CEOs of hospitals do you see that are women? And that is something that we still lag behind in. I think there's a lot of women pioneers and women who have come before us that have done a lot of this work, but we still have a long way to go. I think there's a couple of challenges within that. It's when women are aggressive and trying to go after something, it's looked at a little bit differently than when a man is. And I'm not male bashing at all. There are certainly very successful men who have done great things, but the perception is a little bit different, right? If a man is really aggressive and advocating for what he wants, he's a go-getter. Whereas if a woman is, it's not seen the same way. In fact, it's often seen a little bit more negative. If a man gets angry about something, it's because he's passionate, right? And if a woman gets angry or emotional, it's because she's a woman and she got emotional. And so until that's different, there's going to be challenges within that. I think you can see that in everything that's happening in the country right now. So I certainly think that whether intentionally or unintentionally, sure, have I not gotten maybe a promotion or maybe looked a little bit differently because I was a woman in my role? I think yes, 100%. I will say though, I'm a white woman and I certainly will not, I have privilege associated with that. So I can't, yes, I'm a woman, but I'm a white woman. And I certainly appreciate that there is privilege that I have that women of color have not appreciated the same. And so, it's a little bit more of a challenge for me because I realize those discriminations exist, but, for me to say that I didn't have privilege because I'm white is outrageous. And it would be completely remiss of me not to say that. So, I think that that's important. I do think though that women, we have to advocate for ourselves. We have to advocate for other women. And slowly but surely, I think we'll make gains there. We're going to have our first female vice president, right? And no matter what your political affiliation is, that's a big deal, right? Hopefully that will continue to set the stage for women who are strong and intelligent to be able to expand that platform. But sure, I think that this is always a problem. It's interesting. We just created, I'm faculty member in our Department of Emergency Medicine, and we just recently created a Women in Emergency Medicine group, if you will, within our department. And we've had 3 or 4 meetings in the last couple of months, and we all have the same thought. It's more of a challenge. Women take on more, right? Even if you're not married or don't have kids, you tend to take on more. And once you add relationships and families in there, oftentimes your professional career will get put on the back burner, whether inadvertently or not, because you're doing other things. And so I do think it's a challenge. But I do say I do have hope, as far as I have a lot of friends who are really making great progress and have gotten some really great promotions. So I think we're getting there, but it's I would say, to younger people, again, advocate for yourself, put yourself in situations that, are going to make you better. And, I think we just have to all revisit that idea of what a passionate person is, regardless of if they're male or female. So there will be challenges, and certainly women of color face far more challenges than white women. And it's probably white women's job to actually step in and recognize those a little bit more, because we've done a really bad job up until now. But there is going to be challenges, I don't know. Hopefully in 20 years it'll get better, but.
Thank you, Dr. Marraffa. That really makes me happy that there are people out there who are like looking out for the next generation, so that we can hopefully have a better future.
I hope so, because I'm going to be retired by then. So I hope, but, and I think a lot of discussions and movement has been largely from your guys' age group. Even if you just think about a lot of activism that's happened, in the last 2 years, it's younger people, right? And so I think just keeping that line of communication open, I think, again, you have to recognize, I've tried to be doing something a little bit more, because you're always going to be busy. You're always going to, and women tend to always say yes to more things, right? Like it's, well, yeah, I can do that, right? Like, and I'm completely at fault for this every single day. Like, you want to keep taking more on because you don't want to be like, oh, I can't do that, or, because I'm too busy, because then that's a sign of weakness, or, asking for a raise, right? Women are historically bad at saying the things that they're good at, to ask for. The things that are like an absolute yes, like, yes, that is like without a question, yes. If I have to think about it, then I'm like, all right, I need a day or two to think about it. And then I'll really think about it. But if it's a no, and I know that, it's now a no. Whereas 10 years ago, professionally, I was like, I would do all these things because I didn't want it to be a sign of weakness, where now I'm like, I'm sorry, my plate is too full. I can't do that. And so, and you have to navigate that the younger that you are, and you will all take on too many responsibilities until you start learning this. But I think that you should be thinking about that as well.
Thank you. That's great advice. I know I'm already taking on so much, and I'm just like, how am I supposed to do everything? And then you do it, but it's like, it does take a toll on you.
Yeah, you do it. And that's the thing. And then people keep giving you more things, right? And they're like, wow, she gets everything done. We'll just keep giving her more things. And while I think, hard work is so important, and I think that there's, there are things that you have to do sometimes that you don't even want to do, especially early in your career. That just goes without question. But I think there has to be a balance. And I find that, especially with, like my friends and people that I know now, it's really in our mid 40s that we figured out that balance. It wasn't in our 20s and 30s. It certainly wasn't when we were 17 or 18. So just know that early on, it's probably going to be more of a challenge. Later on, you're going to look back and be like, oh, okay, I got it now. Now I understand.
Thank you for that.
I also wanted to ask you if you had any interesting stories you'd like to share. So for example, when doing some research for this interview on the SUNY Upstate website, I found that you were featured on an episode of Dateline NBC. I was wondering if you could talk about the intersection between toxicology and criminology a little bit more.
Sure. Yeah, so it's interesting. So a couple of years ago now, part of what we do, every day we take care of patients and provide recommendations, and I have a good relationship with our medical examiner. We have combined conferences that we do every 3 or 4 months, is really just a way for us to educate each other, to collaborate and things. And so the Dateline issue really it actually happened. It was not something that I ever had intended. And in fact, that's probably one of my most challenging professional experiences. So I get a phone call from the medical examiner in Onondaga County several years ago. And we had known each other for a long time. And he was like, Jeanna, there's this case that we really are struggling with. So it was a person who had already passed away. We had not been consulted on this person while they were alive at the hospital. And he's like, there's just something that, I don't know. There's something that's off. We can't really explain her cause, why this lady died. Can you come over here? And our offices, my office is kitty corner from the medical examiner's office. So I said, sure, I'll come over. And we do this not infrequently, where it's like, there's this case, like, I don't know, do you think that this could be a poison or a toxin, and vice versa? I'm like, I have this lab result, do you think how do you interpret that in the postmortem setting? So not an uncommon interaction at all. And so I went over there, and there was actually it was the chief medical examiner who called me, but it was a brand new medical examiner who I had never met before. And he was like, I have this case, and, we just can't explain it. This, otherwise healthy woman in her 50s, comes into the hospital and then dies like a day later. And we can't really explain why she died. In fact, she came to our office because she had fallen in the hospital. And so, let's look at this. And I did an autopsy, and there's nothing like overt, like she didn't have like a bad heart. She didn't have like a stroke. He's like, but it's weird because her cells, like if I didn't know better, I would think that she was a cancer patient getting chemotherapy. He's like, that's what her organs look like. And I'm not a pathologist. So I was like, okay, I'll take your word for it, And he's like, oh, I want to show you a couple things. And I was like, okay, you can show me whatever you want, but I'm not a pathologist. And he's like, okay, but he's like, all right, this is a normal cell. And so we went through all this thing. He's like, I can't explain it. And so I was like, gosh, I'm like, this seems odd. And so I was like, there were obviously a lot of things that are like toxins wise that were going through my head. And I was like, I don't know. I think this might be colchicine poisoning. And it's kind of funny because at the time, now he had never met me before. And he was like, colchicine poisoning. He's like, no, you're wrong. He's like, nobody's on that medicine. No, it's not it. You're wrong. And I was like, okay. I'm like, I'll keep thinking about it. Let me look at her records, and he's like, and it sounds like even on the Dateline episode, they make it kind of sound like hysterical, but he's like, listen, I only literally have one specimen left to send off for testing. He's like, we have one test left in order to be able to say what this woman's cause of death was. And I was like, well, that's unfortunate. There's one blood test left. And he's like, yeah. And I was like, okay. I'm like, well, I still think I would get a colchicine level. And he's like, it's not colchicine. I'm like, okay. I'm like, I'll keep thinking about it. Let me go back to my office. Let me talk to a couple other people. And so he went into his boss and he was like, she thinks it's colchicine. And his boss was like, well, Jeanna doesn't usually say things if she doesn't like really think that, he's like, so if she said it, it means there's good suspicion. And so I come back and, I had a list of things, but I was like, well, I don't know. So a week later, he calls me back, look at everything again. I was like, I still think it's colchicine. I'm like, her clinical course is very consistent with colchicine. What you're telling me about the autopsy is, kind of like makes me think colchicine. And so he's like, okay, I'll do the level. And I was like, I'm probably wrong. I'm like, at first we're like, is she on it? Like, is she on this medicine? No. She doesn't take any medicines. And then like 3 or 4 weeks later, I get a phone call at like 7 a.m. I was walking into the hospital and it was him. And he's like, guess what? And I was like, I know it was negative. I'm wrong. You don't have a cause of death. And he's like, no. He's like, it's really, really high. And I was like, what? And he was like, it's really, really high. And I was like, oh my God. I was like, okay, well, she must have a prescription for colchicine and we just don't know it. Or, so we started doing some digging and we find out that she takes a lot of supplements. So then we really started getting worried, like, could she have taken, like, could one of her supplements be contaminated with colchicine, which happens to a lot of like dietary supplements, right? Because they're not regulated by anybody. So there's been like prescription medicines either intentionally or unintentionally put into like dietary supplements. And so then we were like, oh my gosh. So I was like, well, if that's the problem, we have a really big public health problem. And so we got the supplements from the family, had them tested at the New York State Department of Health laboratory. And in a couple of days, we indeed found out that those were negative. So at least we knew there wasn't like a bigger, like widespread contamination problem with one of these supplements. And as the case evolved, there was a lot of other investigative stuff that was happening that I didn't even know about at the time. And come to find out, it was the police were involved and had reason to believe that she was murdered and that it wasn't an intentional overdose. And so the cause of death became homicide, or the manner of death became homicide, and the cause of death became colchicine poisoning. And so then after that, it very quickly, someone got arrested. There was obviously a lot of investigation. Someone was arrested. There was a jury trial for which I had to testify not once, but twice, because the first trial, it was a hung jury and they couldn't decide if the person on trial was guilty or not. So they couldn't come to a unanimous decision. So it was a hung jury. And then it had to be a retrial. So I had to testify twice, which was, for me, one of the hardest things I've ever had to do in my career. There was just so many implications of testifying in a murder trial, right? You've got someone who died, and then there's also someone on trial for murder. And so that was a big challenge for me. And the Dateline episode came out after that trial, but it was not something that I had intended to be. I thought it was just going to be, an intentional overdose. And in fact, it was not. So that's probably the outlier of my career, where a case that seemingly was so, not small because someone died, but seemingly so regular to turn out to be something so much more than that. So hopefully that's an outlier of my career. I hope I never have to do anything like that again, to be honest. It was a big challenge for me. Like I said, I struggled with many different components of just the actual like trial itself, of having, just the repercussions of all of it was just a big deal. So, but yeah, that was the Dateline, probably my one and only Dateline, hopefully my one and only Dateline appearance in my career.
Yes, thank you so much for sharing that. That was very interesting. Of course, like being on trial, like being involved in a trial like that is something no one signed up for, but like I love that you like knew exactly what it was, like after looking at those cells. Like that's very interesting to me. So for this like last segment, I was wondering like if you had anything else you would like to share.
I don't think so. No. I think there's nothing I can really think of. I do think that, if I think that it's great that you guys are doing this. I think that, I guess one of my thoughts always is, especially early on in your lives, is if you have this interest in STEM, be prepared for challenges, be prepared for failures, but also be prepared for great success as well. So all of those failures and challenges will only lead you to being successful. And so I think that's probably it. I don't think I have anything else, unless you have something specifically that you wanted me to talk to you about.
I think we went through all of the main questions. Ismak, okay. Is there anything that you would like to ask?
No, I just want to say thank you for being here with us. We really appreciate it.
So yeah, I'd just like to thank you once again for joining us at this interview.
Okay, thanks to the both of you. Have a good night, okay?
Thank you.
Bye.